Enter the room.
Hello, my name is Michelle Perez. My GMC number is 12345. Can you start?
Yes.
Thank you. Hello, this is Dr. Michelle calling from the hospital. Am I speaking to Gary Marley?
Yes, this is.
Oh, hi, Gary. I'm one of the doctors who saw your son, George, a couple of days ago.
Yeah.
Is it a good time for us to speak on the phone?
Yeah, sure. What is this about?
It's about your son. We wanted to do some follow-up, if that's okay.
Yeah, sure.
Okay, how's he doing?
Well, he's still crying because of that incident. We were playing around but you guys gave me a painkiller and everything, so I'm trying to manage, but he's still crying. I don't know what to do.
Okay, yeah. I'm gonna ask you a few more questions about that before we move on to what we might be able to do for him.
Yeah, sure.
Has he had any fever?
No.
Have you checked the food for any lumps, bumps, redness?
Yeah, nothing of that sort.
Nothing of that sort. Has he complained about anything else?
No, he's just not able to walk properly because of the pain, and he's got sort of crying sometimes. It's
Okay,
just hard to bear.
it's hard to, yeah, I can imagine. Would you mind reminding me which painkillers we gave to you?
I'm not sure. I'm not sure. Just check it on your notes if you can.
Yeah, I can do that. So when we discharged George, we told you that his X-ray, there was just a bit of soft tissue injury. Is that correct?
Yes, he injured when we were, walking in the beach, and I brought him immediately though. So,
Yeah, that's always good. Nevertheless, Gary, sorry, the radiologist, so that's specialist on X-rays, he's had a closer look at the imaging, and
mhm.
he's seen that there is some foreign bodies in his soft tissue, so in his foot, and not the bones, but apparently in the skin and the tissue below the skin.
What do you mean? You guys already saw the X-ray. You said nothing was there?
Yeah, I'm sorry. This doesn't happen often, but we must have missed it. That's why the radiologist had a closer look at it, and he identified something that we as junior doctors sometimes cannot see.
Okay, so you missed it? Do you mean that you missed it? You saw the X-ray, you missed it, and now someone else saw it?
Yes, that's what I'm saying.
How can you be so like that's a blunder that you're making? How can you do that? Why did you not call the radiologist in the beginning itself?
Yes, Gary. So for diagnostic imaging, the radiologists, they still see everything. But in A&E, because we cannot and we shouldn't have hold your son for 2 days in A&E, we still discharged him as we ruled out bony injuries, which is what we use X-rays for.
Okay.
And we were reassured at the time that he was doing better and that he didn't have any fractures. Nevertheless, he's still in pain, and we have found what must be glass. Uh,
Okay.
so we're kindly asking you to bring him back into the hospital for us to review him, see how we can help him with the pain.
So I have to bring him back again to the hospital. Now I have to drive
Yes,
home from my work and bring him.
yes, I know this is unfortunate, and I apologize on behalf of the team. I know this is not news you were expecting, but we are concerned about this. He will be seen by the team and by our seniors, just so that we can remove the foreign bodies, um, and we can give him some more pain relief.
Okay, so I'm gonna bring him to the hospital now and you're gonna take off the glass and he's gonna be okay?
We'll have to review him first. So before we
Okay.
do any procedures, we're gonna have to check him again, just to
Okay.
see his vitals, see he doesn't have any fever, talk to him, see how everything's going, and then we'll have to decide whether we're able to locate what we saw on the X-ray, or if we need to do some other imaging before that. We might need to do some ultrasound just to check where it is, or if it's something that maybe we can palpate so we can feel whilst doing the physical exam, we might be able to remove it ourselves.
I mean, okay, you'll do all of that procedure, but what is the guarantee that this wouldn't happen again?
Yes, so we will fill out something that we call an incident report form.
Okay.
That I know sounds boring to you, but that is essentially for us to reflect on what might have happened so that this doesn't happen again. It is a bit of a lengthy process, but if you want, we can give you the summary of our outcome, see why this has happened. And at present, I really don't know what happened, so that we missed it, but unfortunately, we did miss it.
Do you know who is responsible for this?
Um, so sorry, so it would have been the doctor who interpreted the imaging.
2 minutes remaining.
And I would be filling out the incident report for myself with my seniors, regardless of whether um, we continue with the process for the incident report form. We also handle these cases in our meetings so that all of us junior doctors can learn from this unfortunate mistake.
Okay, I do understand you learn from your mistakes. That's all right. But what about me? I want to complain against you. Is there something that I can do? I want to take a talk with your senior or someone like that. I want to complain.
Yes, that's okay. There's a service that's called the PALS, so that's the Patient Advice and Liaison Service. They're the ones who deal with the patient complaints. And once in hospital, you can also talk to my seniors if you wish to do that.
Okay, I'll bring him. And you told me it's a glass sort of thing. So, do you think he'll need something or less tetanus? Because one of my friend's daughter had some sort of injury and they gave her a
Yes.
shot.
Has he had his jabs up to date?
Yeah, he is.
Yes. So we'll double check that once he's in hospital.
Okay.
For tetanus, it's usually with metal, not with glass, but we can check the wound and we can check if he needs it.
Okay.
Is there any other questions you would like to ask?
No, I just want to complain, and if
Yes.
someone could help me with that, it would be grateful because I don't know how to complain. You guys should help me with that as well.
Yes, we can give you the details for the PLS,
Okay.
and then all of the complaints will be with them, and you can rest assured that we will do our incident report form so that this doesn't happen again.
Okay.
And
I'll
thank you
bring
for
him to the
being so
hospital.
understanding, Mr. Gary.
Yeah. Okay.
Okay, bye. Have a good day.
Thank you.
Move on to the next station.
All right. Hi, Dr. Michelle. That was really good.
Hi, thanks.
Hi. So good job. That was a angry patient, and these kind of cases are actually very difficult
Yeah.
indeed. But that was a very good attempt. Dr. Tanmay, do you have any feedbacks?
And once again,
Mm,
Dr. Lari, you can raise your hand when you're ready with the marking, and then we can hand it over to you.
All right, sure. I think I'm done. I
All
have
right.
submitted it, so yeah.
Absolutely. We'll just ask Dr. Tanmay if she has any feedbacks off the top of her head, and then we'll move on to Dr. Lari. Yeah.
uh, I felt like a bit more of red flags, like she asked about fever, but
Mm-hmm.
about the wound itself, a bit more.
Okay.
Yeah.
Absolutely, because this is a missed error,
Yeah.
and you need to see that, because of this error, there hasn't been any complications.
Yeah.
So you have to be very careful in these cases because it is your error. It's the error that has happened from the doctor's side. So you have to make sure that it's not causing much pain, right? Like do no harm. So
Yeah.
make sure that rule is followed.
So, that actually brings me to a good point. Dr. Michelle, when Dr. Tanmay asked you, so whose mistake is this? What do you think? Do you have any, do you take any blame in this? Do you think you shouldn't have, you should have picked this up?
I mean, in terms of like in real life, if it was myself who would have given the misdiagnosis, I would take the blame. But if it's
Mhm.
part of a team, I would say like at present, I don't know who's responsible, but the incident report form allows us to know who might have like
So,
been at fault.
so one thing I want you to notice is, so the case it says you saw George Marty 2 days
Yeah.
ago,
Mhm.
discharged him, right?
Yeah.
So you discharged him,
Yeah.
and so how do you interpret an X-ray? Is there someone who is there a gold standard for interpretation of an X-ray?
I would have to double check for foot. Like you always check for like correct patient, that it's been technically done correctly.
But
Um,
X-ray is something is it's the clinician is the physician's responsibility, right?
yeah.
So
Yeah.
you
Yeah.
even as an FY1 or an FI2, you
Yeah.
are it's your responsibility. If you see something on an X-ray,
Yeah.
you can't ignore
Yeah.
it. And
Yeah. Yeah.
you saw it, you said it, it's normal, and then you discharge them. It
Yeah.
doesn't matter who reported the X-ray. It
Yeah.
ultimately went through you. All right.
Yeah. Yeah.
So this is a very important point because these are the cases where they see if you are actually taking the blame or not.
Okay.
So these are the points. These are the cases where you have to clearly show that you are actually admitting to the mistake.
Okay. Yeah.
Because if this was a blood test, then you could have said, okay, probably the lab did some mistake. But this is
Yeah.
an X-ray report, so this is something that you have to do. Look at every
Yeah.
X-ray that
Yeah.
comes to
Yeah.
your hand. You have to see it for sure.
Yeah. Yeah. Yeah.
And since it's a kind of a service, you always have to validate their feelings. So when it comes to an angry patient, the first thing you need to do is you have to validate how they feel. So if they feel that there's a mistake been done, agree to that fact because quite frankly that is a mistake. And if you feel that it is a mistake, you have to agree to the fact. Like, I'm so sorry, this has happened. Unfortunately, our team failed to see this in
Yeah.
this finding in the X-ray initially.
Yeah.
So, admit to that, tell them you're sorry, and then bring pals in. So if you do that, then you don't have to explain yourself because towards the end, you were actually struggling with the procedure of what's going to happen to the child,
Yeah.
right? Frankly, you don't know. What is
Yeah.
going to happen is you're going to make sure that he's all right. There's not any complications. You're going to take out the glass piece,
Yeah.
and you're going to give him more painkillers, right? And
Yeah.
you're going to tell him that once the glass piece is out, then it should get better, right?
Yeah.
Those are the only things you can say because these are the kind of that's the process that the whole healing system takes. Like, since the foreign body has been removed, he should get better from now,
Yeah.
right? And you're actually telling him what could happen because you're not definitely telling him anything,
Yeah.
right? Please bring him in, we'll take it out, and we'll give him stronger painkillers. If there are any signs of infection, we'll give him
Yeah.
antibiotics. So
Yeah.
these are the procedures. But if you're going to make things up, like we'll do another X-ray or something
Okay.
like that, or do a ultrasound and all, I mean, it's not in your hands,
Yeah.
and you don't
Yeah.
even know if you can use those resources. Like,
Yeah.
there needs to be a definitive reason why you're using ultrasound and all of that,
Yeah.
right? Unless it's indicative. So make sure when you tell him that you'll, and since it's an angry patient and this is a mistake that has happened, also involve your seniors,
Yeah.
so that they also feel validated that somebody in the senior a senior in the team will also be attending to them. And so you have to roll out the red carpet for these guys because the mistake was done from your part. So you'll do
Yeah.
everything in your power to make sure that they are comfortable at this point. Yeah.
Yeah. Thank you.
All right. So we'll move on to Dr. Lari. Sorry we took up a lot of your time. But yes, Dr. Lari, please.
Right. So, well, all in all, I think you did well. It's not bad. Just a few things that you missed. With regards to your data gathering, you did mention George's name. You did not confirm his full name and age. You only asked your son George, and
Okay.
yes, he confirmed, but you didn't confirm his age, which means that you didn't fully identify him. Secondly, you didn't confirm his first line of address. These are things that you go through to be sure that you're talking to the right person. So you confirm his name, that's the parent's name, but not the child's full name and his age. And then you did not ask for their first line of address, which is basic. Then you didn't ask the parent about the sequence of the injury, what happened, and then what he's been told. Actually, you did verify, but you said it. I think it would have been better if you asked him the sequence of events. That way, you save a lot of time because the
Yeah.
patient will usually volunteer the information and even tell you what medication they're on if they know it.
Yeah.
Yeah, so I think that part you missed it, and then you didn't find out whether or not they had any allergies, or in your data gathering you could have also asked about their vaccination history. You missed that part, and because of that, in your management you didn't address the tetanus. The simulator had to prompt you before you talked about it. But otherwise, I think your data gathering was straight to the point. You didn't spend too much time asking about unnecessary questions, which I think was excellent. With management, you actually did explain in simple words, and you went straight to the point to explain the error. You apologize, which I think is perfect. You didn't, however, emphasize the fact that because initially the parents said, why should they bring the child, and they have to leave their work and come. You could have at least emphasized the fact that there could be complications if the child does not come in time for the glass to be removed. You did address the tetanus issue, but you made it sound like you cannot get tetanus from glass. I don't know, but I think anything that is contaminated with Clostridium spores can actually transmit, yes, tetanus, not just metal.
Okay.
So you watch out for that. You didn't also arrange for a follow-up after you've done your incident report and all of that. You could have arranged for a follow-up to update them on what has been done so far. Your interpersonal skills, I think, was okay. You empathize very well. However, I don't know whether it was because of time, you didn't allow them too much time to express their anger and emotions. But all in all, I think it was okay. So I scored you 2 for data gathering because you missed some relevant parts with regards to, like she said, she raised red flags about the fact that you didn't ask a lot about the current injury and whether or not they had any allergies or how the painkiller was helping. So I scored you 2 on that one. Then with management, I scored you 3 because I think you did very well, and your interpersonal skills also I scored you 3. So all in all, you had 8, which is a pass.
Okay, thank
It's
you.
not bad.
Thank you.
So well, maybe just a little more practice, and I think you'll be fine.
Yeah.
Your confidence was okay, like straight to the point.
Thank you.
You're welcome.
Thank you, Dr. Lari, for that detailed explanation. And of course, you brought out a lot of good points there. Definitely, patient identifiers are very important because you need to understand who you're talking to. You can't miss all the identifiers because if it's given to you in the question, you have to make sure that you confirm it. So whatever is given to you in the question, you have to make sure that is used. So the reason why it's given is for you to use it. So if there are important tasks that are mentioned, sorry, within the question itself on what must you do and special notes, make sure you keep an eye out for these things because if you don't follow through on these tasks, your management is going to definitely take a hit. And the other thing about the tetanus toxoid, yes, any injury, any soft tissue, deep injuries, you actually have to make sure to give TT.
Okay.
It's just not with metal. And how Dr. Laurie very rightfully pointed out,
Yes,
it could
thank
be
you.
contamination of anything with the spores of the Clostridium.
Yeah, and in this case, the boy doesn't need it because he's had it 3 years ago. That you should have
Okay.
asked in the
Yeah.
history.
Yeah.
So the protection, the period of protection that you have is about 5 years. So if it's not given within the 5 years, then you can say that yeah, he can take another dose, or we need to give him another dose.
Yeah.
And since it's been in the skin for a while, then that is also something that you have to keep at the back of your mind.
Yeah.
Yeah. I guess we've covered most of it, and yeah, we'll be giving you a detailed feedback on how you did with the feedback form as well.
Okay, thank you so much.
Do you have any doubts?
Any questions?
No, in terms of the platform, would this allow me to practice with non-medical people?
Absolutely. For example, we can just see this case itself. So we have a very detailed patient information. So it tells everything that they need to know in simple language, where they have all the emotions that they need to show, and we've given all the history. So any question that you ask, they'll have an answer for it. And so we have a simple way to share with anyone. So you can practice with anyone who is not near you also. So all you have to do is click on this button, and it will open a video call for you, and the same video call will be open for the other person. So we'll copy a link to your clipboard. One second, I'll just drop off the call. Yeah, so you get a link that you basically paste it, send it to your practice partner, and they'll be
Yeah.
able to open it in the same meeting, and they'll be able to mark you, and they'll be able to be your patient as well.
Okay.
And so we also have a AI patient. So even if you don't have a practice partner, you can practice with AI patient as well.
Okay, thanks.
And so other than that, one thing I wanted to emphasize is, so this is a medical error patient scenario. So always think about what the key theme of a case is, like what are the examiners expecting from you. So in a Breaking Bad news case, they'll be expecting you to be empathetic. They'll be expecting you to break the news in layers. So that's the main thing. So there's something called a spikes protocol. So they're expecting you to follow that. In a medical error patient scenario, they are looking whether you will admit to the mistake or whether you will push the blame on someone else. That's very, very important.
Okay.
Because that will entirely change the course of uh, the patient's like what their
Attitude.
rights are, right? So it's ultimately about whether you will end up causing the NHS or the GMC a lawsuit. So ultimately, that's all they care about. So however, whatever you feel, if you feel that there is a mistake, just own up to it. Say that I'm very sorry. This is absolutely our error. Even I should have checked it properly before I discharged. Unfortunately, it's you can always say that this is something that tends to happen in an X-ray. It's difficult to find these things.
Yeah.
But the problem is there's nothing else. It's not like a CT scan was done and then
Yeah.
something was found. So never try to find excuses.
Or don't try to justify it.
Yeah.
Right. I mean, sometimes it shouldn't come out as a justification. Like if you do that, then the patient doesn't feel validated. So
Yeah.
once you start doing that, then they start reacting to these things. So you want to keep them as calm as possible. Sometimes there might be some scenarios when it's not actually error. Like there is a case where a child with cerebral palsy has an ankle injury and an X-ray hasn't been done. So the father comes back to meet with the doctor and then say that you mistreated my child because of his mental ailment. And so it's not something that is your fault. It's the protocol, right? That's
Yeah.
what you have to tell them. But
Okay.
you have to still validate their feelings, saying that I'm so sorry you feel this way. I can understand where you're coming from. Say soothing words like that so that they feel validated, right? Because there might be something that you might have missed, and you
Yeah.
don't know the incident properly. So you want to ask them how they're feeling, or I mean, how their experience was. What is it that actually happened according to them, and validate that. See that you will do everything in your power to investigate and make sure, this doesn't happen again, or they feel validated, or
Yeah.
however you can improve their experience. Right.
Okay.
So, one important thing that we actually tell everybody is that when you hear the 2-minute bell, start wrapping up your case.
Okay.
So, the means of wrapping up the case is, you need to always do these three things, that is, safety netting, follow up, leaflets, and pamphlets. All right. So, in this case, safety netting would be if you see any signs of sepsis, right? So, you have to don't use sepsis, make sure you use layman terms.
Yeah.
If you see that the pain is getting worse, if he starts having some fever, right? If he stops responding as playfully as he usually is, so please bring him back immediately, right? And follow up, because yes, one other thing about I wanted to mention was incident report. So incident report is an internal thing. So it's like a audit. So you don't share those information
Okay.
to the doctor, I mean, to a patient. So just say that this is something that we do internally, just to make sure, our quality of care improves. But I will definitely arrange a follow up to let you know what has happened.
Okay.
You won't show them any reports, but then you'll
Okay.
actually tell them the results of what has happened.
Yeah.
Right? We've been conducting an internal audit, or improving so and so. These are some things that you can tell them in the next time they meet.
Yeah.
Yeah. So for them, you should always tell them that you will get them in touch with pals, right? I mean, there is a
Is it?
service, and I will do everything in my power to
Yeah.
make sure you have a place to rent.
Is it?
Right.
Is it them that need to contact pals, or I contact pals and they contact the patient?
So basically, since you are in a hospital and it's a department within your hospital,
Yeah.
and they are already angry,
Yeah.
you just want to make, the whole situation more comfortable for them.
Yeah.
So it's always better where you tell them that you will take them to pals. It seems like you want to help. It comes across like that.
Yeah,
Okay.
and it's for PALS is not just for complaints. It's for anything patient related. So
Yeah.
they can direct them to any resources that they require. So it's not there's no stigma about sending them to PALS or anything like that.
Yeah,
Okay.
it's like a feedback service actually. So
Mm.
even if you think that there is no mistake that has come from your side, just make sure you say that, just to make sure that they are calm. It's like, direct them to HR. Most of the people, within an office, if they have a complaint in a corporate world,
Yeah.
they usually direct them to HR. So basically, that's what you're doing, right? If you have any complaints, I will get you in touch with PALS. There is a department in our institution which handles complaints, and you can give your experience to them, and they will make sure that the right thing is done by you.
Yeah.
You've got to be very generic about this, but you have to tell them there is a place where you will find help, you can
Yeah.
vent,
Yeah.
because that's what we want to do, because ultimately you are treating them,
Yeah.
and it was actually an error. So you have to make sure that they feel comfortable to come
Yeah.
back, they want to come back, and do the needful.
Yeah. Yeah. Thank
And
you so much.
we'll give you a recording of this, and I would like you to go through the recording once and just observe, just watch at least the 8 minutes, watch it a couple of times, and look at if you're convinced with your interpersonal skills,
Yeah.
because
Yeah.
sometimes that's the best way to understand if you're actually putting out the empathy that you want to put out. Because what happens is, as you keep practicing, it becomes very robotic. You'll
Yeah.
end up saying the same thing again and again, and you will feel that, okay, the first time that you said it, you must have said it really well, but after some time you'll forget that aspect of it. So always make sure you're watching yourself in the mirror when you're saying things like these. I'm so sorry to hear that, and things like that. And don't hesitate to overuse these phrases where, oh, I'm so sorry, I can only imagine how you must be feeling, and things like that. So there's no there's a lot of people who think that that might come out to be insincere, but it's all right. I mean, it's an acting station, so it's fine. You have to act. So,
Yeah.
so make sure that you use these stop phrases in between where you show the empathy, especially in situations where, for example, in the beginning when she mentioned he's been crying and I don't know, it's not getting better and things like that. You immediately all you said was, oh, I'll just ask you a few questions. So always make sure you add one, at least something in between, so that it just segues into your asking a question, right?
Yes.
Otherwise it comes out very robotic. But I'll let you judge that. You
Yeah.
just watch your consultation and make sure that you are convinced.
Yeah. Thank you.
All right. All the best.
All the
Thank
best. Thank
you.
you, Dr. Michelle. Thank you, Dr. Tanmay.
Bye.
Dr. Lari. All right, guys. Bye.
Bye bye.
Bye.
Please like and subscribe to Turing Med School. Good luck with your preparation.